you tell us a little bit about the eHealth strategy for the Netherlands?
Well, in the Netherlands we don't have a standalone eHealth strategy. We have a strategy which is aligned with the strategy of the total healthcare system. And we try to move from systems to people, from the back end of the system to the front, and give people more involvement of their own health, and eHealth could be supporting to that.
And what would you say are the kind of key priorities among that?
Well, key priority, we have set three important goals. That we want 80% of the chronically ill have access to their patient records, to their own patient records. We want to have 75% of the chronically ill have access to self-management and all kind of self-testing. And we want everyone who has care at home gets involved with e-consultation or online therapeutic diagnosis. So that's three main goals of our system, which are very patient-centered. And that's, I think, the switch we are making from supply and vendor-driven to patient-driven.
And how far along are you amongst the two?
Well, we are starting with it. We're making good progress, but we have set these goals for 5 years. So in 5 years we have to get results of it. But in some areas like diabetes, etc., we are quite ahead on achieving those goals.
And what would you say are the key challenges that you're facing in trying to meet those goals?
What the key challenges are is to get really eHealth in the minds and the hearts of the people. People are used to go to a doctor, and maybe they get to be used to go support their own healthy living, to go from going to a doctor to self-management. That's it's a real change of culture in a lot of societies, but as well in the Netherlands.
And you mentioned before not relying on vendors and suppliers as much, but how are you trying to sort of stimulate innovation amongst vendors?
We have to rely on vendors and suppliers because they make the stuff we need. But when it's not coming to the people, when it's not in the hearts and minds of the people, then it won't be used. And that's what we think that the switch we make to getting people used to having eHealth as a normal way of going to the eHealth, to the healthcare system, is one of the best strategies you have, also for suppliers and vendors to sell their stuff.
And eHealth Week is coming to the Netherlands next year. Why should we be excited about that?
You should be excited because it is in Amsterdam, because it is in our beautiful country, and because our country is a digital society. We have almost 100% of the citizens in the Netherlands have access to online websites, etc. So we are a digital society, and that's what we want to share, and we want to learn from other people, and we want to do that in Amsterdam.
Excellent. Thank you very much.
Thank you.